Hey y'all, and welcome back to my channel. On this page, I talk about technology and money, sometimes hockey. If you're new here, welcome to the page. I'm glad you are here and that you found this page. If you're returning, welcome back. Today, I want to talk about nursing and mental health. It's something that's been weighing on me pretty heavily here the past few weeks, and I want to give a trigger warning for anyone who comes across this video or listens into it. I'll be talking about self-harm, self-harm and self-harm thoughts. So if you're not in a space to hear about that topic or engage in that topic, via comments or sending me a message, please do click off this video now. So nursing and mental health, this is something that has been weighing on me really heavily recently. Specifically for those who have not heard, there was a registered nurse who committed self-harm. Her name was Tristan Kate Smith. And she didn't make it through her self-harm event. Very young. She was 28 years old. Her name again was Tristan Kate Smith. And on August 7th, she passed away. And it wasn't until her father wrote a letter to their local newspaper about her, and that letter to the newspaper, he did a op-ed, but he also included a letter that Tristan Kate Smith had written prior to her self-harm event. She was a registered nurse. She worked in the emergency department. And she was having some mental health challenges, like so many of us who are nurses do. And unfortunately, she did not make it. And I just want to say, I know this video probably won't get to her family or her friends or her coworkers, but I'm so sorry that I was so sorry to hear about about this event for her. I just wish condolences on her family, her friends, her coworkers, anyone who knew her. And if you are a nurse working anywhere, I know that for many of us, that the past 3 years, like with the pandemic and everything that happened, COVID, it was really hard on nurses working no matter where you work, right? And it really weighed on me when I heard the story. And I was at a social event this weekend, and there were some nursing folks, there were some nursing friends there, and we were talking about this. And some of those nurses are at the bedside. Some of them have left the bedside. Some of them are like me, like I work in tech. One of the nurses worked in an ambulatory setting. We were talking about this nurse's story, but just also our own, mental health and, what we do to keep ourselves healthy, but just how heavily this story has weighed on us. But not only for Tristan Kate Smith, but, for people that we also know. So I want to send some encouragement, and I'll share a resource. I always like to share resources as I come across them, but also encourage folks, if you are a nurse, or if you have a nurse in your family or a nursing friend, check on your nursing friends, right? If you know of a resource that you can share with them, and if you are, or if you're in a space to listen to them, offer them support and encouragement, and just ask them, do a wellness check, ask them if they're okay. And more than just, is there anything that you can do for them? If you see they're struggling, offer like specific help. Again, if you're in a space to be able to do that, and or offer a resource, and also show that person and grace. One thing about when I came across this story, on Tristan Kate Smith. I actually saw it in an Instagram post from I saw that, I think, an Instagram post from a news outlet. And I went into the comments. This is one reason why I try to avoid comments on certain types or many types of stories. But what I went into the comments to see, what resources were there, just, looking for things positive. I don't know why I did that, but I thought it would be there. But what really took me back, which took me a couple of days to even speak on it, was the lack of grace and compassion for this nurse. I was so shocked at the number of people saying that she should have left her job, or just the statements. And not in defense of those people, maybe they just don't understand, but it just really took me aback. The amount of people, I'm assuming some of those folks were not nurses. I don't know. But if you have never been a registered nurse or worked in healthcare, I just think there's just a level of understanding some people don't have around what it takes emotionally, even if you are emotionally healthy, that it takes to care for another human being if they're healthy, but also the amount of emotional load that it takes to care for another human being who is not healthy. And when you have a desire to do everything you can to help that person become healthy again and or stay alive, just the emotional load and the emotional labor that takes. And this is a job, right? But so for many nurses, it's not just a job, it's a calling. And some people really have a level of really wanting to do what is best and do everything in their efforts to take care, to provide the best level of care for someone. So if you take an emotional load of that, and just the amount of empathy and compassion because you are wanting to do the right thing, you're doing the right thing, and then you have, that's just your job, right? You're a nurse, but that's just not who you are. It's a part of who you are, but you may also have like your family and things going on with your friends or things going on in your personal life. It can weigh on you. It weighs on many of us, right? And I'm just thinking about the conversation I had with some of my nursing friends this weekend, how deeply touched we were with this nurse's story, and how we were offering compassion and empathy to each other. We are not at work, totally in a social setting. But I just wanted to offer encouragement to nurses, and to say, if you feel like you need time away from wherever you work, bedside, ambulatory, peri-op, operating room, insurance company, do that, right? If you need a mental health day, take that. If you have to, go and talk with someone and decompress, do that. Show grace to yourself as well as to those around you. I know it can be a lot. I even when I work in tech now, and some days my days are so crazy, I don't even eat lunch until like 4 or 5 p.m. And I work in a business corporate type environment. But I also remember when I worked at the bedside, I worked in oncology for 5 years. I loved it. I loved working with the patients. I love working with their families and doing all that I could to provide optimal care. But it was still a lot. It was a lot emotionally because I saw a lot of people get healthy and beat their cancer diagnosis. I saw a lot of people who did not make it, and people of all ages and all backgrounds and socioeconomic status, and people from United States and outside of the United States. It could take a lot, right? And it's interesting because I saw an email, like I'm part of some professional nursing organizations, and I saw an email that the American Nursing Association sent out last week. They didn't specifically mention this nurse's name, but they did talk about and shared a resource around burnout prevention and stress management, and it offers CEs, CNEs. And I'll share that. I know for some nurses, that's not the best resource, right? There are so many things that are happening within the profession of nursing that a CE sometimes just ain't enough, right? It's nice to have a CE where you can watch a video about burnout and stress management. That may be enough for some people. It may not be enough for other people, right? And even if it is enough, you still may have to go to work tomorrow and be short staffed or not have enough supplies or have to deal with the public or having to deal with people whose expectations on how the healthcare system works versus how they expect it to work does not match up. And you, as the nurse at the bedside or as that front facing care provider, have to take the brunt of that person's frustration, or even if they're not frustrated, just helping that person deal with their illness and providing the care and all the other things that come with being a nurse, no matter where you are practicing. I just felt so much compassion and so much hearing about this nurse that I know that maybe a C is not enough. Maybe you do need to go talk with someone. Please do that. Do what you have to do to healthily deal with your mental health and the burden of providing care. There is so much happening within the nursing profession. And I think people who are not nurses, who have never worked in healthcare, just don't understand the depth of what it takes to practice as a registered nurse. I just think sometimes people just don't understand. But I'm going to take a moment here to share this interesting I thought the TikTok was interesting. And I know this nurse, his name is Nurse John. He makes a lot of content about what it means to be a registered nurse, but he has talked about at length about his mental health and why he left the bedside. And he makes videos around that. But I know this video, I feel like this video he made was in jest, but when I was reading through it, it's at over like 100,000 views. But when I was going through the comments, there were so many folks who identify as nurses who felt that the video was relatable. And he kind of gives it from a perspective of not a nurse, but as the family member of a nurse. Let's see if this will allow me to share my screen. Okay, if y'all just bear with me, I appreciate it. Let's see. It says it is sharing. Yes, it is. Okay, let me make myself go away. Y'all just bear with me one moment. The repeats will go away in a second. Matter of fact, let me do this. Let me stop sharing and just share the one window so it will not look so like it's so much going on. But I do hope folks are having a good day. Okay, so this should be sharing. Okay. Oh, sorry. Let me do one more thing. Let me make sure the audio shares. Sorry, y'all. This was an impromptu live, and I always appreciate. Yes. Okay. Yes. Also share audio. Yes, it says the audio is sharing. Okay. And I'm just going to play this TikTok, right? Because it just gives a perspective, not to make light of anyone who is dealing with any mental health. But sharing, I just thought this TikTok gave an interesting perspective from someone who is a family member of a nurse. So I'm just going to play it and let you digest. Okay. And I'll be silent.
She's here. Oh my God. Let's go. She's going to run mad today. Music.
Begin to allow your awareness to drift a heaviness as you drop down. Nothing to change.
Hi. Sorry. I didn't want to talk to you. I just want to ask, do you want to borrow
it right
or a
now
glass?
or rub it? Is the
I'm also just going to take your bags, okay?
Listen.
Okay, thanks.
That's what your higher self wants.
Sorry, I don't want to disturb you, but I made some chicken nuggets for you.
Trust what you witness. feels where the two of you are connected. Passion.
Ooh. Be careful. Okay.
The yes in your high heart.
What's your bathrobe? Sorry, I got you 2 kinds of ice cream. Do you want churros or chunky monkey? This one. I know you're eating, but which true crime do you want me to play? Hey, do you want a back and feet massage?
Sure. Yeah. I need that.
Okay. That's it, y'all. That was the TikTok. There was a lot to unpack in there that I picked up on. I picked up on some themes. If you picked up on some themes, please leave a comment. I picked up on exhaustion. The partner wanted to create a calm, quiet environment, showing their partner grace. That person also having to tiptoe around because clearly that nurse, looks tired, looks exhausted. What led them to cry? Just a lot. It was just a lot. I'm still unpacking it, but I'll leave a link to the letter that nurse, that Tristan Kate Smith left to her. The letter was titled "A Letter to My Abuser," and she addressed the letter to the health system that she worked at as a emergency department registered nurse. I'll leave a link to the TikTok. Oh, and there was one other thing I wanted to share that I'll just show this resource, this mental health resource from the American Nurses Association about burnout and prevention. Again, I know for some folks, a CE may not be enough. Like listening and watching videos about burnout and stress is not enough. But for those who this may be a good resource, this is that this would be a resource for that will work well. I'll share it. It is an ANA membership benefit, so you have to be a member of the ANA to access it. But it has like some videos on dealing with burnout, identifying how to address your stress, things that you can do. There were some interesting stats here that the ANA shared. That almost 80% of ICU critical care nurses talked about feeling exhausted. The number of nurses who report feeling overwhelmed. The number of nurses who feel like their employer values their mental health. This number surprised me. This really surprised me, especially considering the number of nurses who work at the bedside or work, for a healthcare or non-healthcare facility, and knowing everything that has happened within the last 3 to 4 years and the impact to the nursing profession, and the number of nurses who intend to leave their position within the next 6 months. Again, this is just one resource. This is not the end all be all. I'm just sharing it because I came across it and it was just interesting. Like once this unalive, this letter from this nurse, a letter to my abuser came out, and I've seen the different TikToks, and I've seen one video. There's a nurse I follow here on YouTube. Her name is Kendra RN. She's a nurse practitioner. I watched her video, but it's real interesting. I believe this may have been a response from the ANA about this nurse and her mental health and things like that. But I just want to take a moment to just show grace, just express my condolences again, because, it just weighed heavily on me, to know the impact of having to deal with so much, made this nurse feel like her only option was to do that. And I wanted to express my condolences to that and show some grace and compassion to her family, friends, and coworkers, but also to you. And when I say you, I'm also saying to myself as well, and encouraging folks to, do what you have to do in a healthy way to deal with your mental health. Your job is not your whole life. There is people and resources out there to help you if you feel like you need help. And also for people around you, if you may not be a nurse or you see someone is struggling, if you have the capacity to extend help, to that person, please do so or offer a resource. And take care of yourselves, y'all. Okay, that's it. That's all I have today. And I hope everyone is well. And have a good day wherever you are. And I'll see you in the next video.